Hey guys, Dr. Tim Uselton here with Trinity Integrated Medical, and I want to reach out to you today to kind of explain some of the myths that we hear in the office when it relates to osteoarthritis. Osteoarthritis, or called oftentimes OA as an acronym, it can be in the weight-bearing joints. It can also be in the non-weight-bearing joints. You can get osteoarthritis in the hands, which are non-weight-bearing, in the elbows and shoulders as well. You can get it throughout your spine. You can get it in your hips. You can get it in all major joints, knees, ankles, the bones between the feet, the middle part of your back. We see those degenerative changes on x-rays oftentimes throughout the body. You can even get osteoarthritis in your jawbone, between your mandible and your zygomatic bone here. So it happens everywhere, but one of the misnomers is, especially in the elderly population, they tend to come in sometimes and say things like, I got the arthritis and it's moving around my body. I used to have it in my shoulder, but it's all moved down into my knee now. And they almost say it like it's this something that flows in their body, arthritis. Or it mysteriously shows up here and then comes away and then shows up there. And in all honesty, that's a misnomer, because it doesn't move around like that in your body. Now, once you have it in one part of your body, you got it, right? It erodes the bone, it rips up the cartilage, it damages it and degenerates it. And so now you've got an x-ray that shows the markings of osteoarthritis. Very easy to see. Like if you saw an x-ray, you don't even have to know what x-rays look like to know when someone has arthritis, because you can see the bone spur formation, all these little points. They're called spurs for a reason, because they replicate the spur on the back of a cowboy's boot, right? And so in your spine you see this, in your knees you see this, in your shoulder blades you see this. You see it everywhere when you have osteoarthritis in that particular area. But it doesn't then suddenly go away and the x-rays don't show it there anymore. They show it in your knees. You might have it in your knees too, and it may become asymptomatic in your shoulder, but you still have those findings unless you've done something to change that. Now, we have a couple of things that we do to change that, but that's really not what this video is about. We do offer regenerative medicine. People have surgery to remove those types of markings and osteophytes, they're called, little bone spurs. But usually the surgery leaves so much scar tissue throughout the soft tissue that it's kind of a moot point to go in and decrease your bone spur formation by doing an activity or surgery or operation that will then increase your wear and tear. So we try and do things naturally to fight osteoarthritis, and in different body parts there's different techniques on how to do it. But the bottom line is osteoarthritis, just if you look at the word arthritis, arth meaning a joint, itis meaning inflammation. So arthritis is when a joint is inflamed, and oftentimes it affects all the soft tissues around that joint. So you got muscles, tendons, ligaments, even nerves compromised sometimes due to osteoarthritis. The other thing is that people often say, oh yeah, my mom had OA real bad, my grandmother had OA real bad, and so I've got OA. And I would reply to that, the only reason that you have OA because your mom and grandmother had OA is because you did the same things that they did to get it. You did the same things and got it just like them. It wasn't hereditary. Osteoarthritis is not a familial history where, oh, they have it, so that means they gave it to me. Those are systemic arthritides, which would be things like psoriatic arthritis or rheumatoid arthritis. Those are systemic. Those are found in your blood. You can find the factors. They're genetic. They got brought down from someone else. And some of those things are definitely handed down to you from someone else, unbeknownst to you. But osteoarthritis is not one of those things. You got osteoarthritis in your knee because something in your body is wearing and tearing improperly or faster than the other body parts. So you've got misalignment as a factor that causes wear and tear, and you've got time as a factor. So if you're misaligned when you're 4 years old because you had a fall on your roller skates and you jammed your back and your spine and your hip didn't work good for a while and your mom said, oh, you'll grow out of it, and it got better. Well, something was off, and then by the time you're 25 or 30, you've got osteoarthritis in your knee or your hip. And that's very young, but you've been misaligned for 20 plus years. It doesn't take that long. So obviously people come in here in their 60s and in their 70s and maybe their 80s, and they say, oh yeah, the orthopedist said that I got osteoarthritis in my right knee because I'm old. It's old age. And my reply to that was, how old is your other knee? And how old are your shoulders? They're all 85 years old if you're 85 years old. Doesn't make sense that one wears out faster than all of the others. And it's because that there's been a misalignment, and it could have happened when you were 50 and now you're feeling it and seeing it when you're 80. Or it could have happened when you were 5 or 6 and you're seeing it when you're 80, and it's 3 or 4 times as bad because you've had more time for the misalignment to cause that wear and tear. So that is osteoarthritis in a nutshell. It involves inflammation of a joint and the surrounding tissues, and there's lots of natural ways to treat it. You don't need joint replacement surgery. You may not. You don't need steroid injections because the negative side effects of steroids are covered in another video, but they're too many to name. And so osteoarthritis is not something that moves around in your body, and it's not something that your parents gave you. It's something that you caused on your own because of some wear and tear misalignment, and you never got it fixed. That's one of the reasons why we don't recommend a lot of over-the-counter medications for joint pain, because you can trick yourself into saying, I don't have pain, when you've been on a painkiller or a Tylenol even, or ibuprofen for such a long period of time. Your body is still breaking down and wearing and tearing improperly because you never fixed it. You just gave yourself something orally that would cause you to not know it's being changed. You broke the signal between the pain and your brain and its perception. It's no different than driving your car along and the check engine light pops on your dash, and you get out some tape and you cover up your dash and you keep on driving as if nothing's wrong. We would not do that because it doesn't make sense. However, we do that with our body and osteoarthritis every day. We take more drugs in this country than any other country, and half the time it's because of pain, and half of that time it's because of arthritis pain. So it's very, very common to medicate and medicate and medicate. Meanwhile, your body is still breaking down, and then you finally go in, you say, you know, it hasn't been so bad. It was bad a long time ago, but now I've been taking Celebrex and this, that, and the other. I've gotten a few steroid shots, and so it usually is pretty good. And now we go, oh, shoot, you're way far gone. You're very, very, very decreased in your body's proper movement and in your joint spacing. And so we would just recommend, don't let it go on. Don't pop pills thinking you're fixing the problem. You're not fixing the problem no more than putting tape over your indicator light that your check engine needs to happen, and you never open the hood. You never get under it. You never look and see what really is wrong to fix the problem. You just remove the indicator. That's all that medication does. So Dr. Tim Uselton here, TrinityIntegratedMedical.com is where you can find lots more information. And I hope you enjoy the videos. Give me a comment below and watch the rest. And we'll go into more detail about each of these subject over time. So Dr. Tim with Trinity Integrated Medical, take care.